Are you wondering how a liver biopsy is done? Let me tell you people. Most of the time, a liver biopsy is done in the hospital. Before the test, you may be given medicine to prevent pain or to calm you down. Your doctor will use an ultrasound machine to find the correct spot for the biopsy needle. Then, the skin is cleaned, and numbing medicine is injected using a small needle. A small cut is made, and the biopsy needle is inserted. You will be told to hold your breath while the biopsy is taken. This is done to reduce the chance of damage to the lung or liver. Don't worry, the needle is removed quickly. Your doctor will then apply pressure to any bleeding, and finally, a bandage will be placed over the insertion site. Remember, if you receive sedation for this test, you will need someone to drive you home.